Welcome to Difference Talks. Let's say you're a 52-year-old woman in great health. You take a genomics test and you learn you may be at risk of colon cancer somewhere down the road. What can you do about this? Well, we're going to learn today that you very possibly can get ahead of that outcome so it never becomes reality. Today, we meet with Dr. Jamie Renbarger. She is in charge of Parkview's Precision Health. And we meet with Dr. Michael Mirro. He is the founder of the Mirro Center of Research and Innovation. Dr. Mirro told me that we are democratizing those types of tests, meaning they're available to you and me for free. We're going to have a conversation today with those two wonderful doctors. And I think it could be life-altering, perhaps life-changing. Let's go right to it. Please share what you're doing with the genomics and how this is actually open, as Dr. Mirro said, open to everybody.
Absolutely. No, I think that's one of the most wonderful things about the work that we're doing is that it's really intended not only to benefit individual patients, individual people, but the health and wellness of our state and beyond. So one opportunity for individuals to get their whole genome sequenced, exome sequenced, and beyond. And I say exome just to clarify, that's considered sort of the meaty part of the genome where a lot of the actionable findings are located. And so we're focused on that initially. But individuals can get that testing done at no cost and have results returned related initially to three very high-risk genetic conditions related to cancer predisposition as well as familial hypercholesterolemia as a way to empower them to take action, as you mentioned in your case at the beginning, to take action to keep themselves healthy. Once that's done, beyond that, the opportunity to add on additional tests, right, to look at a more comprehensive, longevity-focused genomic panel is available to them at very, very low cost. So we're talking $100 for a comprehensive test to really evaluate risk for a whole variety of illnesses that we know impact health span and lifespan.
So let's say, and we all know somebody like this, you have a number of different symptoms and you go from doctor to doctor and you can't find the answers. There are a number of issues you're dealing with. We all know people like that. Some of us may be that very person. Does this precision health approach help me, if that's me, in this quest?
Yeah, such a great question. Yeah, in fact, it does. In fact, we have a test that physicians can order today, right? That allows them to query the genome of people who we call diagnostic odysseys, right?
Mhm.
Have lots of different stuff going on or seeking out medical care from lots of providers because they don't feel well. And no one can quite put their finger on a single pathology that's really driving it. What this test actually allows is us to query the genome to understand, is there a gene that's actually driving that illness? That helps to streamline care, to make sure that the individual is connected with the right kind of specialty physician to provide the care that they need and to address their illness.
Dr. Miro, in addition to cardiology and electrophysiology, you're also trained in geriatrics.
Correct.
What drove you to found the Mirro Center for Innovation and Research? What was behind it, and what were you searching to solve when you did that?
So the basis of the work at the center is to create a center that would focus on bringing the best therapy and the newest therapies to patients to the bedside and also the clinic. And so the journey started over 30 years ago. We talk about healthcare. Well, healthcare in the United States and in the world is really care. We wait till the disease expresses itself and then we react to it. Health is about predicting disease and preventing the disease from emerging, as Dr. Renbarger articulated. So I think we now very excited about about this because with Jamie joining our team, we now have launched a full-blown precision health program that is now health care, stressing the health, not the care.
And as you say that, this is an important point. So let's go a little deeper. Is it fair to say that much of what we call healthcare today is really sick care? Somebody gets ill, somebody is sick, then there are pharmaceuticals, there could be surgeries, et cetera, et cetera. But by that point, it may be too late, or certainly at that point, your life has been altered, maybe forever. What you're looking at is preventative care where you can get ahead of an issue. So, what does it look like, Dr. Jamie, when a person goes in for genomic testing? What do they go through? What is that experience for them so that our audience that hears this may go, wait a minute, I thought it'd be scary. I thought it would be painful. I thought I'd have to wait a long time. What is the experience you've developed there for any individual that walks into the lab?
So, for any individual who is seeking out genetic testing, either independently through our DNA Insight study
Mhm.
or with their medical care provider, the process is simple. It involves signing a consent.
Mhm.
Um, then agreeing to have some kind of specimen collected. That can either be a blood sample that's done at any Parkview lab or a buccal swab sample, right? Which patients, individuals can collect themselves. Takes minutes, literally minutes. That sample is sent off to the lab, sequenced, and results are returned generally within 8 to 10 days. For anyone who has a positive test result, our team calls them or a provider calls them personally to inform them of the results and to talk about next steps. It can be a little scary or, even though the genetic change was there before the test was done,
Sure.
to actually find out, oh wow, I actually am carrying a gene that increases my risk for developing breast cancer or colon cancer or whatever it may be. That could be a lot to take in. So we talk to them personally about it. And then we help with setting up next steps. Next steps being one, if you do test positive, we want you to have access to talking to a genetic counselor. So, as part of the study, people can access a genetic counselor at no cost and have a conversation about what this means, not only for themselves, but for their other family members and is other testing warranted. And then we also help with setting up follow up medical care, whether that's with a high risk cancer clinic, a cardiologist, a primary care provider, to make sure that any screening or other interventions that may be beneficial to keep that person healthy can happen. So it's a very easy process.
For 99% of us, we're going to learn we don't have that predisposition. I think most of us will learn that, right? Because it is rare.
It's actually about 2% of the
Okay,
population
98%.
are positive for one of the conditions that we're
Mhm.
testing for as part of this study. And so far we've tested over 30,000 individuals and have gotten positive test results back on close to 500 people.
We're going to have people right now going, oh boy, what about my privacy?
Mm,
Are you taking my information
mhm.
and are you going to share it? So that's one of the fears. And I think if you can take that away for us, then you're opening the door to more people wanting to participate. So,
Participate.
Dr. Mira, what's your answer on that?
Well, first of all, by agreeing to be in the study, you allow your de-identified data.
De-identified.
De-identified data,
So that means it's there, but nobody knows it's my data.
correct. And we're coupling your what we call phenotypic data, which is your medical record,
Mhm.
which is basically your symptoms and also your journey as a health in healthcare, to the genomic data. You're allowing us to use that data for drug discovery. That's all. But the patient owns the data. And at any time they can say, I'm uncomfortable, delete my data, delete it. And they can drop out. Um, but that being said, it's not going to be shared. It's stored. Helix is the company that we work with. It's stored on their server, and we only query the data as needed. So that's what's in your electronic health record, the data that's been queried. So the patient is very secure. It's not 23andMe.
Hmm.
It's
Right.
completely different, so a lot more secure, and there's a lot of safeguards around this. There are 20 health systems doing this study, and when it's completed, it'll be the largest de-identified data set in the world, where you have phenotypic data connected to, genomic data.
What I would add for individuals who are interested in having the testing done, but don't want to participate in a large study, they still have the opportunity to come to us, to be seen at Parkview, to have clinical genomic testing done for the exact same panel of genes at a very low cost. The cost outside the study for that initial test is around $200, and to have the same results returned, but not have their data shared as part of a larger research study. It's a very personal decision, right? One, having your genome
Sure.
sequenced,
Right.
and then two, having that as part of a research study. As having worked, both of us, in the field of precision health and genomics for a long time, I have a lot of confidence in the safeguards that are in place, such that, again, I feel very confident in offering this opportunity to myself, my family members, and our community.
Now, if I'm not in the area that Parkview serves, do I reach out to Helix? Do I find them online or do I not have that option?
Even for individuals who are outside of the Parkview catchment, one, as Dr. Mirro said, there are 20 health systems across the country participating. And so it's possible that individuals in other parts of the country may be getting care at one of those health systems. So that would be one
Mhm.
option. The second is individuals from anywhere in the world can participate in the study at Parkview. They can consent to the study online, and instead of coming to a Parkview lab to get blood collected, can actually select to have a buccal swab kit sent to their home,
Mm.
and results can be returned, and everything can be done virtually.
Now, that is something I did not know. So you could be in a different part of the country and be able to reach out and be able to say, I'll send this sample over to you and I'm part of the study and it's free for me and I get the information.
Absolutely, absolutely. And if you want, we can certainly give you information to put in your show
We
notes
will do that.
with a link that goes directly to the page for individuals to get more information and to consent.
This genetic testing is very expensive. I would have to think, and I don't know for sure, Parkview has invested millions of dollars into this testing. It's not something that was given to them for free. Their goal is to have 100,000 samples in there so that they can better understand the individuals either in our region or in general the individuals who have become part of the program. Why did Parkview and does Parkview continue to invest in this? Because there are other places you could put millions and millions and millions of dollars and staff members, Dr. Miro.
So Parkview invested $10 million in this over 5 years, and, the reason is to transition from a system which is basically a system of disease management to actually prevention, and also to partner with these 20 other health systems in this data set, which is called a Helix Research Network, to allow for drug discovery. And so the clients for drug discovery are large pharmaceutical firms that pay Helix to query the database for drug discovery. One of those clients is Eli Lilly, by the way,
Mhm.
in our own backyard. But other large companies, Novartis, are doing the same thing. And that's going to be the future of medicine. How do we basically also treat rare diseases, for example, there are a lot of individuals struggling with a rare disease and they're looking for answers. And to be able to share a large database like that is a way to find discoveries that could lead to a solution for their disease, to manage their disease.
Dr. Renbarger?
I would very simply say this is the future of medicine, right?
Mhm.
Precision health will permeate the entire field and have a profound impact on how we practice medicine in the coming years. And so while we're starting with a study and this 100,000 individuals, certainly our vision is that any Parkview patient, anyone who walks through the doors of Parkview and gets their care from Parkview has the opportunity to have their genome sequenced so that we can use that to help inform care. This is not only limited to identifying risk for specific diseases such that we can preemptively take action
Mhm.
and empower patients to take action to stay healthy, but there's also another really important area that helps us understand um, how patients will respond to specific medications so that we're selecting when patients do need medications, we're selecting the best medication for that individual at the right dose at the right time to one, optimize efficacy and safety so that we can avoid severe and sometimes life threatening adverse drug events, which happen all the time. So, this layer of genomic information over all the rest of the information that we have about patients really empowers us as a health system to provide the best possible level of care. And this is possible.
It is possible. And what is inspiring is this is offered to all of us, all of us. So we have to realize the future of medicine is extending the healthy years of our lives. Over the last decades and decades, we've been in a situation where our lifespan has increased, but the quality of our life may be really poor. Um, Personal story for me, both my parents died of cancer when they were 63 years old. So I joke with people, I'm on my farewell tour. I've been on that since I was 63. Uh, but I lived in a lot of fear of, oh my gosh, what if that happens to me? And I was afraid even to go to doctors. But over the years, I've come around to understand I'd rather know in advance to get ahead of whatever it is than learn too late. In addition, my wife's situation is equally concerning. Both her parents died at 78 of stroke and cardio related issues and diabetes. And their last 5 to 10 years were very, very unhappy years for them. So, what we want to do in this episode is open up our eyes and our hearts to the fact that there is an opportunity right in front of us for anyone, and we'll put it in our show notes, to be able to learn more about their health. And as Jamie and Mike have said, it's up to you. If you get the results and you go, nah, I don't care. I know I have a little disposition. I don't care. That's your life. You have that right. But I've seen this, and Dr. Mirro and I, who are dear friends, have talked about this often. I have heard great, great doctors, including Dr. Mirro, say there is no reason today that people would be dying of cardiovascular related events with all the research we have, with the pharmacy approach that we have, with the surgeries, with all of what we know, but yet it's the number one killer. So the more we can learn, the better. And again, I really emphasize it's not live as long as you can in a wheelchair or a bed and never get up. It's extend the healthy, enjoyable years of your life. When we come back from break, we're going to dive a little deeper into what is really predictive medicine. Dr. Jamie mentioned the idea of, gee, I could learn there's certain drugs that don't really work well for me. So we're going to go a little deeper in that area as well, because we're going to learn, okay, what does that mean? How does that affect how I approach my healthcare? So we'll be right back on Difference Talks.
Difference Talks is a LaBeouf production. Our focus is differentiation, and we believe it's more important than ever to differentiate your brand and experience. Contact us at LaBeouf.com for a conversation. We'd love to connect with you.
We are back with doctors Jamie Renbarger and Mike Mirro. Jamie, we have talked about precision health and genomics testing. There's a true story, a heartfelt true story that really underscores why you've gone so deep into this area. Please share it.
Yeah, absolutely. Now, especially my involvement and interest outside of oncology, right? My original field of training. When I was in my mid 40s, my husband, a super active, healthy guy, runner, swimmer, vibrant part of life, had a sudden cardiac death at home one night. Our kids were 7 and 9, and we went from, right, having a active, vital member of our family member, to not having him. The really striking thing was his dad had a similar event in his late 40s. And so here I am, a young, I say young, mid-40s widow, with 2 young kids, and really thinking about, "Oh my gosh, like, if anything can happen anytime, are my kids safe?" Right?
Right.
How can we avoid this happening again? And that led to a series of medical tests and genetic testing, for my children, to understand whether there was any gene that could help us, predict whether they would be at risk for having a similar event. That had a profound impact. Certainly, it's scary to think about that possibility, and yet having the genetic information really allows them, as now young adults, to really be empowered to keep them safe.
How many times do we walk into the doctor's office, Dr. Miro, and they ask us to write down our family history? I mean, what's that all about, and how's that compared to what
So,
you and Jamie are doing?
so I think historically, family history is important. It's basically your phenotypic history, is what these symptoms you have, but also what you're basically you're trying to delve into what maybe could predict the emergence of a disease by getting a family history, like cancer history, or as Dr. Renbarger articulated with her her story about her family, which is very heartfelt. That maybe you're predisposed for this
Mhm.
of sudden cardiac death, and I think that that's a really important thing to get from the family history, but to have the genomic profile, which actually will tell you what you really are predisposed for, is even more compelling because people frequently cannot remember that their grandfather had colon cancer at age 60. Don't remember.
Yeah.
I have an actual example. One of my partners in practice, as a young man in his 40s, developed prostate cancer. And he went to his father, who's a physician, by the way, and said, "Dad, no one in our family's had prostate cancer early." He goes, "Well, I did." He goes, "You never told me."
Oh my
There we
gosh.
go.
Well, and I went into my ancestry and I researched, as far back as I could, hundreds and hundreds of years. And besides finding that almost all the men passed away in their 40s, uh, I found very little information of how they died other than got run over by a horse and carriage, fell down a step, things like this. And what you're saying, Dr. Miro, is why the genomics testing is so valuable, because I don't know what I don't know. There is no way I'm going to know what 5 generations back one of my ancestors, you know, passed away from. Dr. Miro, I'm going to have a slight spin here, but it's connected to what you and Jamie are doing. I have been impressed with the Miro Center, which is your research and innovation brainchild. What I think is most inspiring is that you look at this beautiful building and you go, wow, that's impressive. But what's more impressive is what you are providing with your team. And I'm going to ask you about this, and I'm going to preface it with, what are you providing to the communities that you serve at no cost and at no affiliation to Parkview Health? It could be to any healthcare
Mhm.
network. What is your team doing?
So we have multiple teams that work in concert. There's 6 teams specifically. We have a clinical research team that brings new clinical trials. That's translational research. We bring science to the bedside, the newest therapies that are available. And patients don't have to be a Parkview patient. They can enroll in the trial and have access to new medications or new treatments. We have a health service informatics team with 30 people on that team that look at how we bring new digital health solutions to the health system, either improving the system of care or also the usability of those tools for patients and also clinicians. We have a precision health team, which we've been talking about, which actually really is transformative. Um, enterprise in the fact that it is really going to be the future of medicine and very exciting. We have offices of sponsored projects that helps manage federal grants. We have an innovation team that looks at new technology, and we do clinical testing of those technologies to see if they would benefit patients or the health system. And lastly, we have an advanced simulation lab. That simulation laboratory is focused on training all healthcare workers, not just physicians, but first responders, all the way to physicians, including nurses, physical therapists, PAs, pharmacists, respiratory therapists, and because healthcare is a team sport.
Mhm.
And so when teams work together in concert to take care of a patient, the best outcomes usually take place.
I want to kind of nudge you on this a little bit. You may be understating your training, your team, and I think this is very, very impressive. Your team is training surgeons throughout the region as well as first responders, correct?
Mhm.
And what is the purpose? I'll just go first responders. What's the purpose of you for free through your team providing first responders treatment so that they can perform better? What's the value and why are you doing this?
So the performance is technical, right? So we're looking at the technical skills and what's the best practices. And so they're allowed to have basically at no cost, we can evaluate their ability to deliver particularly life-saving care, particularly when you start talking about advanced trauma life support, how to stabilize a patient. So I can give you a very concrete example. We have a mobile service. We bring a van out to the rural communities to train those rural communities in not only their first responders, but the ER staff. We did have a physician who worked in a rural area, and he got retrained on how to resuscitate children, particularly young children that underwent trauma from like an auto accident, and how to basically implant a needle in your leg to give IV fluid. But he basically hadn't done that in many, many years when he went through training. But literally the next week he had to do it. He said, I didn't know how to do that. I thought I did, but I got retrained. He knew that that was a deficiency, and so it's an exploration of your potential deficiencies and actually make sure that you can perform at the highest level.
And what is really inspiring is there is a great, great outcry today in healthcare that the rural hospitals are just not up to the standards we expect. And in some cases, they're going out of business or they're certainly stressed. And what you're doing through the Mirro Center is you're raising their standards. And one thing I'll also share, and I'm going to turn to Jamie in a moment, but is that when you are training those first responders, you're not training a Parkview only first responder. This is a first responder, and your goal is to keep that patient alive till they get to the nearest hospital, wherever that hospital is, whatever the name of the hospital is. It's to take care of people in your region. So I thank you for that.
So this is the community benefit that a non-for-profit health system provides to our community. So this is part of the mission that Parkview has really as part of its DNA, if you will.
Now, Jamie, I'd like to turn to you on a question, and many, many, many of us are on meds. We are in a world of people taking not one or two. I have a friend who took dozens of meds on a daily basis. You are able, through your testing, to identify whether or not a person actually will have adverse effects with certain pharmaceuticals. Can you share that and be as granular as you can? Because someone in our audience may go, wait a minute, that could be me.
Absolutely. Absolutely. And that, I mean, honestly, that piece is really what initially turned me on to genomics. This field of pharmacogenomics and clinical pharmacology, really understanding how to choose the right medicine for the right person at the right dose at the right time. And there are a multitude of examples of what we call gene drug associations. And that is a genetic change within an individual that determines or certainly can have a profound impact on whether a medication will work, first and foremost, for that person, and whether they would be at risk for severe side effects or what we would call dose limiting side effects. Something happening that makes them say, "Ugh, I don't like how this makes me feel. I'm not going to take it anymore." Right. So, a couple of examples. So, one is statins, right? These lipid lowering drugs that so many people across the country are taking. We know that there are certain genetic changes that can put individuals at risk for statins causing significant muscle pain. I had that experience. If I'm on a medicine and suddenly I'm noticing that my whole body really, really hurts, and it's because of that medicine, I'm not going to continue to take it, regardless of the potential health benefit of that medicine for
Mhm.
me. Yeah, it was lowering my cholesterol and my improving my lipid profile, but I felt really bad,
Right.
right? So by doing a genetic test preemptively and saying, "Oh gosh, you shouldn't be on this particular statin. You need to select this statin instead because we know that you're not going to have those muscle pains if if you're on a different drug." That's incredibly powerful, right? If a patient needs a medicine, we want to make sure that we choose one that not only works for them but is safe for them. Uh, Another example
Yeah.
that I'll share that I think is increasingly relevant and important in our world is we are developing in collaboration with our genomic partner a model using genetic information together with other information about patients to predict whether specific GLP-1 medicines are going to work well for them. These medicines that millions of people across the world now are taking for weight loss or for help with management of their diabetes, their cardiovascular health. About 25 to 30% of individuals we can predict may not respond as well as the rest of the population to those medicines.
Would that explain why some of us who have been on GLP-1s said the first time I was on a particular brand, it didn't work, and I went on to a different one, and that one worked a lot better? Does that explain that? Is that something that we might learn through this?
Absolutely. Certainly can help in guiding selection of medications, both based on is it going to work? And the other piece with GLP-1s is side effects, especially gastrointestinal side
Mm.
effects, things like nausea, diarrhea, constipation, GI upset. Being able to predict risk with certain medications really allows us to, again, choose the right medicine at the right dose for the individual patient. Because if we're going to use a drug, we want to make sure that we're choosing the drug that is most likely to work and be safe.
So we're going to wrap up. I have a question for both of you. What can I do, whether I'm an employer, motivated person, clinician? What are the things I can do right now? So I'll toss it up to both of you.
Well, as an employer, most of your employees get health insurance through your company,
Right.
correct? And you're very concerned about their health because you'd like them to be productive and have a good, healthy life, and also you're retaining good employees. So, since the United States is so tied up to the system where healthcare is connected to your employment, which is, by the way, is not the optimal model of healthcare. The employer is involved, um, but they really can't see the data. But their employees could be enrolled, for example, in DNA Insights, have whole exome sequencing to see if they have diseases. The employer does not have that information, but it's an opportunity to prevent disease and keep them on the job. So that would be an opportunity at no cost
Right.
to take advantage for their employees. And I think the future of care, particularly employer-based care, is genomic medicine. It makes a lot of sense. A lot of employers who are engaged with keeping their employees have healthcare on site. I mean, they have clinics in their facilities, particularly in manufacturing, to try to help their employees from having more advanced problems, and particularly with physical problems. And so, this is a step even beyond that, that is really would I think the employers would embrace once they understand it.
Yeah, and it would be a competitive advantage for an employer to say, "Hey, we're offering this. we're learning, and instead of, 2 or 3 years down the road having a very catastrophic situation, be able to head it off well in advance. Jamie, any thoughts on what somebody can do today to take action to help themselves in this?
So, from an individual
Sure.
perspective, first and foremost, I would encourage a similar path, right? It's easy to hop online if someone is willing and interested in participating in a no-cost study to learn more about their risk for a number of pretty significant health conditions. They can easily do that. And again, we'll have the link for that in the show notes. Beyond that, regardless of where somebody is in the world, right? Seeking out at your own hospital system, if not, in the state of Indiana, at Parkview Health, the precision health program and what is available through that. There are more and more opportunities to have access to low cost, no cost genetic testing to really understand disease risk. And once you have that initial entry point with some early screening tests, it's easy to take the next step to work with your provider, to work with our precision health team, to do more extensive testing, either based on family history or based on specific health concerns.
Wonderful. Final question for each of you. What is a best day for you? You have been working, you go home, and you're more energized and more renewed. Jamie.
Best day for me. Wow. Um, so certainly for me, just here and now, what I would say is being able to have conversations like this to get the word out, right? I say this is the future of medicine. The future of medicine is now, right? The entree of precision health and really shifting the equation to keeping people healthy and empowering individuals to take control over their health and wellness. Um, it's here and now. And so being able to really having opportunities to get the word out is an awesome day.
Dr. Mirro.
I would amplify what Dr. Renbarger just said in regards the best day is when you see that you're educating, particularly the future providers. We have a residency program and talking to them about genomic medicine, and they get it. And you say, this is great because these providers now are thinking that this is how I'm going to practice medicine and incorporate genomic medicine in everything we do. And that's exciting to see the light come on.
We have spent a wonderful episode talking to two people who truly care about human beings and care about helping people, care about elongating the healthy years of our lives, and opening it up through the Parkview Health Network to anyone who has an interest, anybody, even if they're not here locally. So today I thank Dr. Jamie Renbarger and I thank Dr. Michael Mirro for being with us today. We will leave the information in show notes. This is potentially a life-changing, life-enhancing episode. Thank you, everybody.
Thank you for joining us on Different Talks. All of us at LaBeouf are proud to celebrate great people with inspiring messages. Different Talks was created, produced, engineered, and performed by the LaBeouf team. Even the music is original. Contact us at labeouf.com to learn how to differentiate your brand and give your team a sense of significance and meaning.